much. I'm Anders Holt, medical doctor and a PhD candidate from Herlev and Gentofte University Hospital in Denmark. I'm here to tell you just quick about my study on long-term beta blocker effects post-myocardial infarction. I will quickly take you through the main setup and the main results of the study. So our hypothesis was that beta blocker treatment exceeding 3 months post myocardial infarction in stable optimally treated patients does not improve cardiovascular prognosis. And the way we tried to assess this question was via the Danish registers. So it's a retrospective observational study. And we included all first-time myocardial infarction patients between 30 and 85 years of age. And they all had to undergo a catheter-based procedure during admission, and they had to be treated with both statins and acetylsalicylic acid post-discharge. Moreover, we had a lot of exclusion criteria to get only a very selected group of myocardial infarction patients. So any indication or contraindication to beta blocker treatment, apart from myocardial infarction, if the patient suffered from that, they were excluded. And following their myocardial infarction, we had a 90 days quarantine period. And if they developed any of these conditions or had any outcomes or any further cardiovascular procedures during these 90 days after the MI admission, they were excluded as well. So we end up with around 30,000 patients and started follow-up 90 days after their first myocardial infarction. 82% were prescribed beta blockers, and 18% was not. And we used logistic regression to determine their absolute risk and risk differences 3 years post myocardial infarction.